Hi everyone, this is Dr. Saida Fallafini from Cal Poly Pomona. So in module 4, I want to talk about lean healthcare systems. So in this presentation, we are going to learn what is a lean system. In previous session, actually, we had a brief discussion about this. We are going to learn what is waste and what is waste in healthcare settings, and what are the sources of waste, what is value stream mapping, what is H3 method, 5S, and Kanban. And these last four methods, value stream mapping, H3, 5S, and Kanban, are some of the methods in the lean mindset or lean perspective toward um, production, either production of goods or services. So a car manufacturing company or an aerospace company can use these concepts. They are the ones that are producing goods or products, and a hospital, a bank, a call center can also use these concepts, and they are the ones who are producing services. Okay. So lean is a strategy, is a mindset, is a set of practice that enable organizations to uh, reduce or eliminate, at the end of the day, ultimately eliminate waste and to change for better. When we use resources and the use of resources do not create any value toward our final product or final service that we are going to deliver to the customer, that's what we call waste. So the resources are used, we still spend our time, some resources and we are doing something, but that action is not adding any value and is not adding to the final product. That's what we call waste. And lean practice, lean mindset, as I said, can be used in any application area. In the healthcare setting, is going to help us to reduce waste, or eliminate waste from the work process and from the steps in a healthcare setting, and improve the quality of the care that is going to be provided, and also lead to the customer satisfaction. A couple of concepts that I want us to know before we get more into those techniques that I talked about. Um, One of those concepts is what we call as the voice of customer. And again, this is voice of customer is very general. No matter you guys are going to end up working in a healthcare setting or not, the voice of customer is a good term to know. The voice of the customer is what the customer wants, is what the customer needs. When you end up uh, developing a list of customer requirements, those represent the voice of the customer. Okay, and you as a systems engineer actually end up using that in a lot of future work discussions, conversation, and so it's a good term definitely to know, no matter which field you are going to work on. And then as the organization is performing actions to meet the voice of the customer and to provide the customers with what the customer has required, uh, that is basically providing value, that is delivering value to the customer. However, some of those actions or some of those steps that are done uh, for meeting customer demand, for delivering what customer wants, some of those actions and operations that are done directly contribute to creating that product or service, and some of them do not directly contribute to creating that product or service. Before I talk about healthcare, let me give you an example in, let's say, manufacturing. Let's say we want to build a table. That's our final product. So the time or the actions in which we cut the wood and we are going to do the assembly, those are value added time, because those times are spent in making the final product. But if the structure of the facility is that after the legs are cut, now they have to be transported to another location so that they can get painted, and this transportation takes, let's say, 20 minutes, that would be a non-value added operation. It's necessary. Some of non-value addeds are necessary, some of them are unnecessary. In this example that I gave you, that transportation is necessary. The structure of the facility makes that operation, that non-value added operation, to be necessary. Obviously, we have to be able to paint those legs, and for that to be done, we have to be able to transform the legs to the next operation, and that needs 20 minutes. But that's a necessary operation that should be performed. However, it doesn't add any value to the final product. Still, the leg is the same leg after transportation. Nothing has been added to the final product. So that's why I call it a non-value added. But sometimes the legs are there, let's say, to get painted. However, the painting machine is busy painting other parts. So these legs that are not painted just have to sit there and wait. So that waiting time is definitely non-value added. It does not doing anything to the final product, and is absolutely unnecessary. That's the waiting time that can be eliminated. Maybe if we do a better planning, maybe if we have enough painting machine, when the legs get to the painting machine, they can be immediately painted. So they don't need to wait there. So that's, again, the waiting time is a non-value added time that is unnecessary and definitely should be eliminated. However, that transportation time is again a non-value added time, which is necessary in this setting, but maybe we can reduce that time, or maybe we can find a way to get rid of it if we can change the layout of the facility. Okay, so if we go to the healthcare setting, so let's assume, consider yourself, I'm sure all of you have visited a primary care doctor. And consider yourself who is going to visit your, who are going, you are going to visit your primary care doctor. In this process, by the time that you go, you check in, and all of that happens till you finally see your doctor and you get your prescription, and then you leave. In this process, think about it and tell me one or two operations that are value added. Obviously, I want you to think about it as a process. In your mind, develop a process map of you going to visit your primary care. Develop a process map in your mind and give me two operations that are value added. And before that, tell me what is the voice of customer? What customer needs in this example?
So when I go to the dermatologist, I think a value added step would be I would have, before the doctor comes in, one of the nurses would come in and kind of screen me, get all my information of like my symptoms, kind of listen to what my problems are, and she writes it out on her iPad, and then the doctor, there's only one of him, and so he's going to see all these patients. So I think a value added step would be that he has all the information already in front of him, so that when he gets to me, he can just read outside before he gets into the room, read all the information that I have to say. And then when he comes in there, he can just directly address the problem rather than, trying to diagnose and trying to keep asking all these questions because the nurse has already asked it. And then also the nurse would get ahead of time, like what pharmacy do I want to get my prescriptions to? And so that would add value in that whatever the doctor prescribes, it'll directly just go to the pharmacy. I don't have to take the paper and then head to a pharmacy and then wait and then come back later to pick it up.
Okay, great. So based on what you said, I want to rephrase those specific value added actions, and please correct me if I'm wrong. So then I would say that time that the nurse took to check some of your vital things, blood pressure, weight, height, and things, definitely that's a value added operation, um, the time that the nurse took to enter that information in the system, the time that the doctor took to review that information before visiting you, and the time that the nurse or doctor took to put your prescription in the system and send that information to the pharmacy. And these are the four that I picked from your description. Maybe we can add the time that the doctor do the visit, right? The time that the doctor spend with you, then does the visit. Definitely, that's the value added time as well. But I agree that these are pretty much the most important value added times in this simple operation. Uh, so, what are some of the non-value added steps? And one thing, okay, one more thing, I would say, usually when you go, even if you go to a hospital or even to an office, usually there is a administrative support that does the checking. So also the time that you spend with that person to provide your information, your insurance, also that's another value added step as well. So consider from this step when you come and see the administrative support all the way to the point that you're done, you are getting your prescription from the pharmacy and you're leaving. Okay, we look at like 4 or 5 value added step. Can you think of any non-value added step?
Waiting
The
in the
waiting
waiting
time.
room.
Okay, so where are those waitings? Potential places where the waiting can happen.
Waiting to check in or waiting to see the doctor, or the time between the nurse and the doctor.
Exactly, the waiting times to check in, that's definitely something we can eliminate, or we should. The waiting time to finally see the doctor, the waiting time till the nurse calls you, the waiting time for oh yeah, although they have put the prescription in, but still you may have some waiting time till the people at pharmacy finally put your prescription together. So those are all waiting times that exist in this process flow. And finally, from the point that you enter till the point that you leave, you may have spent like an hour and a half in the facility, but from this hour and a half, maybe half an hour, 35 minutes was the value added time when you spent some time with the nurse or a doctor or a pharmacy, but the rest were these waiting times. And when we talk about patient flow, when we talk about smooth patient flow, we want to be able to look at this process flow. We want to look at all these unnecessary, non-value added waiting times that exist. And we want to be able to find solutions to be able to reduce and preferably eliminate them. If there is a long waiting time before checking, why is that? Maybe we need to hire more administrative support. If there is a long waiting time before we get seen by the nurse or before we get our prescription, then why is that? Maybe either the processes, the system has some maybe issue, that the data, I don't know, is not being transferred to the pharmacy properly, or maybe we need more staff. So what we want to do here with the lean setup is to remove all these waste. So all these non-value added steps are the ones that we want to get rid of. And with the lean mindset and with those tools that I mentioned initially, value stream map, 5S, A3, and so forth, we are trying to look at different ways to somehow either reduce or eliminate the waiting times and other sources of waste in the manufacturing setting. And these tools are applied to any settings. I know some of you are coming from backgrounds or already are working in some areas, and you may not even ever get to a hospital setting, although you never know. But even if you do not end up working at a hospital setting as a systems engineer, these are still valuable tools that you can use in any work area that you're working on. And as I said, these are the ones that are used mainly or that are taught mainly for manufacturing. These tools actually have been developed initially in Toyota manufacturing operations in 1980s, and they have gone through a lot of revisions and fine tuning, and finally they are the tools that have been used by almost every operation so that they can rid of the waste and be more effective and efficient. So in all these tools, in the whole lean mindset, we want to get rid of waste. And the waste are basically all those steps and all those resources that are used, but no value is added to the final product. Based on the mindset that are based on the I was in philosophy that was developed in Toyota manufacturing facility in 1980s, they thought about three type of waste, and they gave them name Muda, Mura, and Muri. Muda type of waste are the activities that do not add any value, like the transportation, the wading, the overproduction. We'll go over them a lot more. But those are the type of everything that we talked about so far. Those are the Muda type of waste. They are easier to understand and recognize, and not a lot, but a little easier to waste or to reduce. And then Mura is the type of waste that we may get because of unevenness in our settings, either manufacturing settings or service settings. Some of in healthcare setup, some of the unevenness that can happen is because of the unpredictability related to arrival of our customers or our demand. Our demand is uneven; it goes up and down, and that causes a lot of resources that maybe not maybe they are prepared, those resources, but they are not going to be used as much. So trying to eliminate those sources of waste is also what we call as eliminating Mura. And then Muri is some of the ways related to overburden or unreasonableness of something. For example, if we have a nurse that is highly trained, but we are using that nurse for some operations that some people with lower level of training can do, that's still a waste. We are using a high skilled resource for some low level operations that is considered as a waste of resource as well. And those are the type of waste that we call as Muri waste. Before I get into the more description of what each one of these type of waste is, some examples of the type of waste in the healthcare settings are related to the over-treatment. Sometimes a lot of medications are used, or a lot of operations are performed that are not necessary. Sometimes it's not necessary for a patient to have an X-ray or an MRI, but they are prescribed for the patient by the physician. And those are a lot of resources and a lot of costs, but are necessary. And those are the type of waste that can be removed. All those extra or additional checking of your blood pressure and all of I don't know, temperature and so forth, all those extra actions, again, they are waste. There is a resource, nurse is sitting there, they're using their equipment to do this operation that they already have performed, I don't know, an hour ago. But those are also different type of waste that exist in the healthcare setting. And a lot of medical errors that happens. There are a lot of wrong surgeries that are performed. There are a lot of wrong medications that are prescribed or that are received. Those are all different type of waste that are that exist, and we definitely want to get rid of those. Okay, so the first type of waste that are categorized in the lean mindset or lean strategy are Muda waste, as I said. These are usually the easiest type of waste to recognize, and a little easy to get rid of. The things related to transportation, you need to transport the patient, or you need to transport some equipment or some supply from one location to another. The waste related to inventory, you are keeping a lot of inventory associated with maybe some of the supplies that are using the risks that are money that are sitting there. They are using a lot of space, but that's unnecessary. There is a lot of motion sometimes going from one location to another or one operation to another, that again, those can be removed as well. Um, um, Sometimes, for example, the nurse performs maybe the blood pressure and temperature in this room, but then for the weight, they take you to another room because there's only one scale, and that's in that other room. But these are all I would call as unnecessary motion that should be identified. But then later, if we want to remove them and how we are going to do that, that's next decision. But these are unnecessary motion. But then a lot of the waiting, like the ones that you just mentioned in the example, those waiting times are also waste that can be removed. Over processing, sometimes, for example, this happens a lot of the times with the information that you provide. You go to especially when you are visiting an office for the first time, you go and fill some forms initially, and then maybe I don't know, in an hour later or in another operation, they want you to fill again some forms or enter some of those informations again. That actually happens a lot with the situations in the mental health facilities. So that repetition of entering information or your information into the system or filling the forms while you already have done that, that's an example of overprocessing. Overproduction, sometimes they produce some kits that they provide to the patients, or maybe they are producing more than what's needed. That can be an example of the overproduction. And defects, obviously a lot of errors that they have in the treatments when they perform the wrong surgery, and all of those are the type of the defects that exist in the healthcare facility. And not utilizing employees properly also is another one. And the example that I told you, when when people are not being assigned to the skills for which they have trained, for example, can be one. And here, one thing I mean, one of the resources I saw had mentioned was the abbreviation. When we look at the first letter of these waste reasons, is downtime. So if you put DOOWMIT and N next to each other, so these are abbreviations of downtime. Just as something to help you to remember these sources of waste. And then Mura is the one related to unevenness in any setting that you're working with. And here definitely the arrival of the patients and the type of help or the type of care that they need and the severity of their situation are definitely the ones that introduce a lot of unevenness into the system. We need sometimes a lot of resources, and sometimes we do not need much resources, but however, it's hard to manage those. And that also introduces a lot of waste. We may ask some nurses to work for some specific part just because they have high demand in those periods, but they may continue working in the next hour in which we have low demand. So, but all those nurses are idle. So that's waste of resources, definitely. The next one then is the Muri waste, which is related to the, as I said, related to the employees and the, for example, burden, undue burden on employees. If we have our staff overloaded and so forth, those are also considered as Muri waste. Some examples here: lack of proper maintenance or unreliable equipment or process. So If we do not have proper maintenance in any facility, that would lead to the maintenance to the facility, to the equipment to break down. When the equipment breaks down, it's the resource that is not being used, and that's again type of waste that can be removed if we make sure we have proper maintenance operations so that we can prevent any type of breakdown that can happen. If we have unclear or ineffective communication methods between different healthcare providers or between different units, those are again would lead to complications, would lead to inefficiency, and those are again different type of ways that we can remove. And if we try to standardize the work in a healthcare facility, that actually is going to help with getting rid of Muri waste. So if we have, for example, if we have a department that is in charge of performing maintenance operations, either preventive or the corrective maintenance, that department with all the instruction that they have, that a maintenance on a equipment that is in charge of checking blood pressure or level of oxygen in blood at operating room, this equipment has to be maintained every 2 weeks to make sure it's working properly. If we do not do that, we may have a sudden breakdown of the equipment in the middle of an operation, and those may take longer to repair. But if we have these standard policies and instruction in place, that is going to prevent a lot of the Muri waste type.